Welcome to this episode of Orthodontics in Interview. It's my absolute pleasure to give you guys Professor Benedict Wilmes. So, a little bit of introduction about Benedict. So, he is a professor of orthodontics at the University of Duesseldorf. He's also published over 150 articles. Most notably, he's also had 400 lectures, including 8 appearances at the AAO. And I will be honest, I am one of those people who very much look forward to seeing Benedict Wilmes when he's presenting. It's an exceptional presentation each and every time I see him. And we'll get on to the reasons why when we explore the questions. He is also the founder behind the Benefit TAD system. He's a member of the Anglo Society of Orthodontics. He's also done a variety of other components as well. So on social media, he's behind the Tadman, which focuses on using the Benefit TAD system. He's a reviewer for numerous journals, including the AJODO, and he's published and also won prizes, specifically looking at lingual appliances combined with TADs, as well as aligners combined with TADs, and that's 2019 he won it. Benedict exceeds all expectations and has also been a professional basketball player as well in the first and second divisions of Germany. Benedict, welcome to Orthodontics Interview.
Thank you so much, Farouk. It's a great honor for me, and thank you so much for inviting me.
I'm really looking forward to this interview and just exploring from somebody who really is on the precipice of what's new in both technology and orthodontics, and just getting insight as to how it's happening and where we're going forward. So I'm really excited about it. So I suppose the first and most obvious question from my perspective, Benedict, is how did you get into using TADs in the first place?
Well, actually, that's a good question, but I think the major point is I was trained in oral surgery before I started with orthodontics at the beginning of 2000, and I was familiar with bone quality, bone availability, and I was not afraid to insert screws somewhere in the mouth. So maybe this was the reason why. And then we saw, wow, there's something very interesting coming from Asia using mini screws. So this is the reason why, at the right time, with the right qualification, we started with to use TADs, and this is the story behind it.
And then I suppose there was TADs in itself, but then to explore it using different appliances. That's really interesting. So, what led you to combine those two ideas?
Well, actually, we learned from the Asian doctors how to use TADs in the other process. So mini screws inserted buccally, interdically. They used indirect anchorage or they used elastic chain. But we started the same in the year 2001. But we saw there are a couple of disadvantages of these buccal TADs. First, from my point of view, failure rate is quite high, especially in young patients. Secondly, you cannot move the teeth anymore. Yeah, if you put a mini screw between two roots, yeah, you could not move the teeth. So we saw a couple of disadvantages, and we learned from Dr. Verbein, who developed the palatal mini implant system from Straumann. Wow, there is a different insertion site, and this is the reason why we switched back to the palette. And our idea was we need something easy to insert, easy to remove in the palette to avoid the disadvantages we saw with the buckle mini screws. So this is the reason why we started early, but we saw the disadvantages of buckle screws and moved to the anterior palate, which is, from my point of view, it's a gift for us orthodontists because it's a great source of anchorage.
And as somebody who occasionally using TADs, to be honest, my level of anxiety has reduced massively since placement to the TADs. I think there's always that anxiety of one, doing any form of surgery, two, being close to something that could actually cause some real harm to. So it's great to see that the progression happen and the mixing of what started off as conventional implants going into the palate and palatal region and small developments there, but then actually you took it over to the mini screw side of it, which was a transition in itself. Now, Benedict, I am a bit of a groupie, so I watch lots of lectures, and I've heard you lecture, as I mentioned in the introduction, on numerous occasions and platforms. But recently, there's been the number of lectures that you've given have looked at both aligners and TADs. Now, I'm interested to know, do you see that combination replacing fixed appliances? Where do you, is that the next stage, or is it a different avenue of travel within orthodontics?
Well, I think there's a big trend to use aligners worldwide, and we will not change it because the patients are asking for it. Many patients think, at least, it's more convenient, it's more aesthetic for them, and many orthodontists and also dentists jump on this train. Okay, so there's a huge trend to use more and more aligners, but we see some limits if we are going and using aligners. And the biggest limit is, from my point of view, root movement, bodily movement, especially of molars. Okay, you can tip easily, you can derotate incisors, etc. But if it comes to bodily movement, we see big problems. And in 9 out of 10 cases, this is my clinical experience, um, it's not possible to move molars bodily. They primarily tip. Okay, so the more we use aligners, or the more aligners are used in orthodontics, the more we need some auxiliaries to overcome the limits of aligners. And I see especially indications for bodily molar movement, distalization, mesialization, but also if it comes to expansion. Okay, we know this now from a couple of papers published about efficacy of liners, and this is what we also see in the literature. So this is not just my clinical experience, this is also what we see in the literature. So to make a long story short, the more we use aligners, the more we need sliders and expanders. And of course, if they are mini screw born, we have additionally not just a guidance to avoid tipping, but also anchorage. So two reasons to use these sliders and expanders from my point of view.
And with that combination, I suppose the next question will be, well, what do you see as being the next? Is there a next adaptation for TAD? Is there the next? I suppose aligners is already done, but what would be the next thing that you see TADs being involved with within orthodontics?
I think the next step will be to make this more convenient for the orthodontist. Okay, so at this stage you need, you mentioned Tadman or any other laboratory to fabricate the slider or the expander, then you have to go address Invisalign or Align to ask for aligners. In the future, this should be out of one platform. Okay, so if you look at big tech companies, Google, etc. It's a platform strategy. Okay, there you go to Google, you get everything. You do get Google Maps, you can buy things, etc., etc. So in the future of orthodontics, I think it will be more convenient if you have one platform, and from this platform you get two appliances and one strategy, so you don't have to upload to different websites. I think this is my personal idea for the future of orthodontics. Yeah.
That's
Additionally, of course, the service for AI diagnosis. Okay, so you have a platform for diagnosis and treatment planning and manufacturing of the appliances. This is my personal vision for the future.
That's really insightful because it's not you've not described it as an appliance. You've described it as a process within utilizing the appliance, and looking at actually now the clinician's component to it, about how the ease of use of the appliance goes, and that comes us to us describing your platform that you've also put forwards and recently, which is a Tadman platform. Benedict, I don't want to describe it in my own words because it'll probably be very mincemeat, but can you tell the audience what is the Tadman platform that you've launched recently?
Well, actually, Tadman is, by the way, hopefully you like the name because for some it like a little bit funny. It sounds a little bit funny. Okay, the platform is, it's more or less all about metal printing, because I think in the future our dental technicians, the orthodontic technicians, they will not bend anymore or not so many times. In the future, They will sit at the computer and design metal appliances, and then they will print it. Yeah? um, by selective laser melting, etc., etc. So, but our technicians are not well trained yet, and I think we as orthodontists we don't have the time to do all the design, etc., etc. So our idea was to offer a professional service to the orthodontist. You can upload a scan of your upper arch or lower arch, and similar to ordering aligners, okay, you will get a proposal for a appliance, distalizer, mesializer, expander. You approve it like you approve ClinCheck from Invisalign, and then you say click, and the appliance is manufactured. So this will give you a lot of time, and I think we as orthodontists can save time because we don't want to get familiar with the software and design there for hours sitting at the computer. Uh, I think most of the orthodontists don't want to do this. Of course, there are always some tech guys that are keen on using and trying everything by themselves, but I can tell you it takes hours, weeks, even months to get familiar with these designs. So, to make a long story short, again, it's a service for metal printing with or without TADs. So, if you want a metal printed CAD CAM designed expander, hybrid expander, even without any Hyrex expander, even without any mini screws, you can also go to Tadman and order it. Okay. So for metal printed appliances, I think this is a nice service worldwide, by the way, if you're interested. It's not just in Europe, it's delivering worldwide.
I think that's exceptional. I suppose it just shows, Benedict, that you are on the cusp of what's new and advancing, is that you describe a platform and a process where this can take place, and actually you have created one in this process. And it is www.tadman.de, and that is where it can be found. And I'm looking forward to using the service. It sounds exceptional about how we can utilize not only digital technology, but just have an easy to access platform, which has some variation to it. So, I mean, there's TADs, there's innovation clinically, there's lingual appliances, there's aligners, but then you've created your own system of TADs, which is the benefit system. So that's another branch of what you've had inception of, and that's got some real popularity behind it. What led you to make your own system for TADs?
Well, actually, there was no system at the stage when we started it. As mentioned before, we moved to the pallet, and there was no system available. This is the reason why. I think, and this is for most inventors a reason to develop something new because there is nothing. So maybe I can tell you how we started in the pallet. We used conventional mini implants like dual top or the Thomas pin, Loma screw. These were the dinosaurs of mini screws. And if you insert them in the anterior palate, you need a connection to your orthodontic appliance to the dentition. So we always need wires. So we took wires from our technician and we connected them with resin. Well, this worked out. This was a little bit a poor man's solution. Okay, it worked out somehow, but in many situations the resin broke and the wire was disconnected from the mini implant. So my idea was we need something where we can connect the mini implant in the palate with a orthodontic wire, 1.1 millimeters, whatever. So this was the reason why to start a mini implant system with exchangeable abutments or with exchangeable wires that you can fix rigidly and safe on top of the mini implant. So this is the reason why we started to work with a mini screw, which has an inner thread. This is the secret behind it. Inner thread, so you can fix something on top of the mini screw. And if you are using mini screws in the pallet, which is from my point of view the best insertion site, the most reliable insertion site, we need this rigid connection to wires. Okay, so there was nothing available at that stage, and this is the reason why we have developed this benefit system.
That's really interesting. That's really interesting on the path of how you got to where you have. It literally was a clinical problem, and then you worked to then resolve it, which hats off to you for making that endeavor. Um, Switching track a little bit. So, as both a reviewer and editor of orthodontic journals, uh, what do you see being the next big thing happening within orthodontics?
I talked about this platform strategy that may help us orthodontists. I think of course, we are always talking about appliances. We're talking about metal printing. Now, printing of direct printing of aligners. Of course, this is very technically addicted, but I think the next big thing will always also be a software. Yeah, uh, treatment staging software. So I think we need good improvements if it comes to these softwares. Which one will be better if it comes to staging, treatment planning, etc., etc. So we have to improve the platforms and the software. Uh, we can now do resin printing, we can do metal printing, but the software, I think, is the next connection part to make everything a little bit more professional and to make it on the next level of high quality treatment that we can offer to our patients.
It's interesting. It's digital dentistry, isn't it? It seems the direction of travel, both not only in our personal lives, but definitely from the professional lives as well, from what you've described there. Benedict, you're a professional basketball player. I'm dying to ask you about what is your favorite pastime. Do you still play basketball? Have you moved on to something else now? Have you created your own sport now? I'm so interested to know, Benedict. So, what is it you enjoy doing in your own time?
Of course, I still love basketball. Yeah, if you play a sport for years on a regular basis, everyday basis, I think you're so much familiar with it. So I still love it. I from time to time do play. In the summertime, I'm going to maybe you heard about it. It's a German hotel chain called Robinson, and there I'm as a coach. So I'm still uh, in contact, good contact with basketball. I do sports every day. Okay, so after a stressful day at the university with all patients, with all research, with all students, I love to go jogging, fitness center, play basketball. In the summer, I like to do inline skating, etc., etc. So I'm quite addicted to sports, to be
Well,
honest.
Wow, excellent. I mean, I'm addicted to chocolate, but that doesn't really help me out at all in my own life. So I envy you again. So, I mean, in the world of kind of COVID and post-COVID, lectures have gone online, and some lectures are now coming back to being in person, and conferences are returning, which has its own connotation to it. But I want to know, what do you prefer? Do you prefer the online webinars? Do you prefer the in-person lectures? What's been your preference? Do you have a preference?
Well, both have their pros and cons, to be honest. I think it's a combination of both. Yeah, I think if it comes to spread and transport professional information, webinars are super. Yeah, you can concentrate on it. Um, but of course, it's not just the information that we want to share. It's also the personal contacts. Okay, and if you come to Düsseldorf in June, oh, we will have lunch together. We have a beer in the evening. I don't know if you drink German beer. Um, but this is, of course, on a different level, okay? And maybe you will tell me a story that you don't tell in any webinar or in any lecture, okay? So it's on another level. Actually, I like both. It depends on what are your things you are looking for, yeah? So there's a good mix of those two. that I would recommend and I personally prefer. I don't
And
know how you see it, but I think both have the pros and cons.
I think it's interesting. I think first of all, we've got to bear in mind you've just invited me for a meal, so I'm definitely taking up on that offer. Just to let the audience know that there is going to be the benefit user meeting happening the 2nd and 3rd of June, which is going to happen in Duesseldorf this year, 2023. I'm really excited. I will be going to that meeting even before Benedict put on the offer to have a free meal with him, but I will also be taking up on that offer as well. My thoughts are, there's a social component to life, Benedict, and I don't think we can escape it. Like if we have a social connection to somebody, we're more likely to be attentive or receptive to what they're saying. But webinars have been phenomenal since COVID's happened, and I think I've learned so much from the process. I agree with you. I don't think there's one. I think it's great we can choose from both now. Actually, I think it's wonderful.
Sure.
And that brings us to the next question about, well, what is, I mean, there's so many conferences you've spoken at, but what's, maybe this puts you in the hot water here, but what is your favorite conference? Is there one that you look forward to each year and to actually, I have to make it to that one?
My favorite one is, of course, our meeting. No, I'm just kidding. Uh, um, no, I like to go to the European meeting. Was, from my point of view, is a good meeting. You will see good research, short presentations about research. If you go to the AAO, you will see good clinicians. I miss a little bit discussions, to be honest.
Mm.
And 10 years ago, there were point counterpoint discussions at the AAO. I'm a little bit missing this because if you go to the AAO, everybody's lecturing about this and that. One lecturer tells you A is the truth, the other tells B is the truth. And I think some orthodontists are going home and don't know, yeah, where to, yeah, what is really the truth. So we need more of these discussion rounds from my point of view, and I'm missing, to be honest, at most of the meetings a good discussion round. Maybe probably you remember these discussion rounds with Vince Cockage, and I loved them so much. I learned so much from these. So this is a little bit what to be honest, I'm missing a little bit. So every meeting has pros and cons, and I love small meetings. I love those big meetings. Um, but this would be my recommendation to add more these uh, discussions.
That's a very,
Um,
very politically savvy answer you've given there. I credit you for it. You mentioned about your addiction to sports. I think it's interesting in basketball. I've got to ask you the question. You're going to have to choose. What would you rather have, a slam dunk or achieve Andrew's 6 keys? What's it going to be, Benedict?
Actually, I would love to do a slam dunk, but unfortunately, I'm I'm a little bit older now, and if I would go for a slam dunk, I think I would have problems for 1 week with knees and Achilles tendon and back, etc., etc. So I'm now, of course, more addicted to the 6 keys of Andrews because it's easier nowadays for me.
It's maintainable. Okay, I'll go with that. You've had a guest blog not too long ago with Kevin O'Brien, where you spoke about maxillary expansion with skeletal anchorage, termed Marpi or mini screw assisted rapid palatal expansion. Now, I mean, prior to that advent, it was either dental alveolar or you went down the sarpi route, the surgically assisted rapid palatal expansion. Do you see Marpi replacing sarpi now? Is this a more refined, less risky version of it? Or do you see it again creating a new avenue? It's a new environment to treat patients with.
I think for sure MAPI is not going to replace SAPI. Yeah, and the more I'm listening to One Moon, he is one of the inventors of the MAPI, and the more I'm listening to his lectures and the recent lectures, he is admitting that there are many patients where we are not able to open the suture even using 4, 6, 8 screws. Okay, so there will be always um, a group of patients, especially male patients, where we are not able to open the suture even using 100. mini screws. Okay, so there will not be a replacement, but using or adding skeletal anchorage, adding mini screws will always help us to reduce dental side effects. And rapid maxillary expansion or maxillary expansion is an orthopedic treatment. Okay, we want to move bone, and I think to load teeth is it was never a good super smart solution. Never, because we don't want to move the teeth. We want to move to maxilla uh, uh, maxilla halves and spread them. Okay, so to make a long story short, we will not replace SAPE. I think the indication group for SAPE will be lower. Okay, so there will be a group of people where we are able to open the suture because we are using mini screws. But the dental side effect, and this is for me the main point why we use mini screws, the dental side effects will be much lower. Okay, not just for expansion, but also for class 3 maxillary protraction. Okay, so this is for me the main point why we add mini screws. Yeah? But this is always, of course, also a matter of treatment costs. I know that in the US, I don't know how it is in the UK, um, patients have to pay a lot of money for the uh, sarpi, for the surgeon. Okay, in Germany, this is not an issue because this is covered by the insurance for every patient. Okay, so there is not such a big, huge need to avoid sarpi. Okay, but I know this is a different story worldwide. Yeah. How is it in the UK? Is sarpi covered by the insurance?
So the healthcare system, it will depend on the severity of the case. So in that
Okay.
respect, patients can be applicable for it, but if it's not severe enough, then it's not something which will fall into that category. But it's interesting how you describe that. It's not necessarily Marpi taking over Sarpi, but it's also Marpi taking over or involving part of the patients who just have conventional expansion. It's kind of in the middle of the two, but it's taking both of their turf, as it were, but allowing for better outcomes to take place for both conventional expansion and perhaps minimizing some risks and costs when it comes to SARPI as well. So that's really interesting. You've wedged it in between those two different components of expansion. So coming towards the last two questions, I really want to know, with your with the experience that you've had and conferences, and you've also already mentioned Cockitch, but I'm really interested to know, who is it who you, Benedict, admire the most within orthodontics? Who is that person?
Well, actually, there are some, from my point of view, super good speakers. I love, of course, Finch Cockage. I learned a lot from his lectures. I learned a lot from Björn Sachison. They had a super precise and super interesting style of presentation. Um, Nowadays, I like to listen to Björn, Ludwig, of course, to Ravinanda and those guys, and which have a, from my point of view, super good style of presentation. And I'm still learning from those guys how to improve my treatment philosophies and also my style of presentation. So these are, from my point of view, the guys that I really enjoyed to listen to, and I still enjoy listening to their lectures.
Fantastic, fantastic. And to conclude the interview, Benedict, what one piece of advice would you give to orthodontists out there who are listening?
Well, that is a different, difficult question, to be honest. And I think the most important point, or the most difficult question for us as orthodontists, to find a good balance between interesting clinical recommendations you see in social media, you see in lectures, clinical tips from experts, and on the other hand, evidence. Okay, and we all have to find a good balance, a path between these clinical tips and evidence. And my recommendation, or what I wish, a good wish for my colleagues, is to find a good balance between evidence and clinical tips. Okay, if you just look for evidence, there will be no innovation. Okay, if you just follow the clinical tips on Instagram, okay, you will do, I think, quite a lot of mistakes, because this is not evidence based, and probably there are some misguiding tips. You see so many tips in social media. So the balance, I think, is the most important point, not just for colleagues and other orthodontists, also for me. Um, this is my tip to find this good balance. Yeah.
That's amazing. Thank you so much for your insight in that respect. And just to finally conclude, Benedict is going to be hosting the Benefit User Meeting on the 2nd and 3rd of June 2023. Please do have a look at it. It's got a star-studded cast of people. Barry Nanda's going to be there. Bjorn Ludwig is going to be there. And of course, one of my favorite speakers is going to be there, who is Benedict Wilmes. Thank you so much for joining me on Orthodontics in Interview, Benedict. And I wish you the best luck, my friend. Take care.
Thank you so much. It was a great pleasure, and hope to see you soon in person.
Just a few outtakes, guys, from today's episode. I hope you do enjoy. Benedict, I've always had an idea of developing my own TAD mechanics and calling it the Farouk slider. What do you think about that?
Farouk, that's clear copyright infringement.
Benedict, listen, I just don't think you've seen the potential that's available here.
Farouk, I do see the potential. The potential is legal action.
Thank you for that, Benedict. I will not be involving you in my future inventions. Thank you for that.